Okay, we're going to begin. Good afternoon or good morning, wherever you're located, and welcome. Thank you for joining Caregiver Insights across the states, translating data into local action. My name is Melina Pinheiro, and I'm the Senior Manager of Health Programs at the National Alliance for Caregiving. We call ourselves NAC for short. Today's webinar is hosted by us in partnership with US Aging, and we're really glad to have you with us. We're really encouraged by the strong interest in the session. Many of you shared on our social media channels that you're looking for practical ways to use caregiver data to inform programs, services, and decision making, and that's exactly what today is about. Next slide. The webinar focuses on how state-level caregiver data can be translated into meaningful local action. The newly released state caregiver profiles provide insights into caregiver trends, challenges, and opportunities across the country. Today, we'll explore how this data, when paired with caregiver experience, can guide program development and service delivery. And our case example today will be from Greater Wisconsin Agency on Aging Resources. Next slide. Before we dive in, I do want to briefly share a little bit about NAC and the initiatives that ground today's sessions discussion. NAC is a national nonprofit organization working on making family caregiving in the U.S. more sustainable, equitable, and dignified for the 63 million unpaid family caregivers across the country. Our work spans research, policy, and practice change, and it's all focused on strengthening support for family caregivers and translating evidence into action. And as you can see on the screen, the logos represent our membership network and it spans different sectors and it highlights how caregiving is not a niche issue. Next slide, please. On the research side, we lead caregiving in the US, the nation's longest running and most comprehensive study of unpaid family caregivers, and we do this in partnership with AARP. This research provides a regular pulse check on caregiving realities and helps inform decisions across healthcare, aging, and policy sectors. And it's a report that comes out around every 5 years, with the last one being released last year. Through the CARE Network, in partnership with the Administration for Community Living, we bring together researchers, providers, caregivers, and subject matter experts to expand data, evidence, and data-driven practices that support caregivers. Next slide. In policy and advocacy, NAC convenes partners across aging, disability, patient advocacy, and caregiver sectors through the Caregiver Nation Coalition with over 130 partners, and this is anchored in the national strategy to support family caregivers. We also support state-level leadership across 14 states, and this is through the Caregiver Nation Network, and it's elevating caregiver issues at both the state and national levels. Next slide, please. And then for practice change, we have our health and wellness initiatives, which uses two complementary approaches to drive change. On the left side, you see that we have our complex care collaboratives, and they bring together caregivers, clinicians, and advocates to share knowledge, develop insights, and accelerate change needed in both policy and practice. And we focus on transplant and cancer in efforts to create cross-sector solutions that can be applied across care settings and condition. And then on the right side, you can see that we have our caregiver voice. And this initiative, we work to better understand the full impact of caregiving, recognizing that data is strongest when it reflects lived experience. And then across all the work that we do at NAC, caregiver voice remains central, ensuring that data and experience together inform policy and practice. Next slide. And the work that we do is guided by our three core priorities: champion caregiver health and wellness, because we recognize caregiving as a public health issue. Many caregivers are experiencing burnout, they're getting sick, or they're struggling with their mental health. We drive economic inclusion so caregivers are not pushed into financial hardship, and we foster caregiver-friendly communities because when caregivers need to be seen as essential partners in not only healthcare but also in work policies and just across the board. Next slide. And to ground today's conversation in lived experience, I wanted to share a quote from Anita, a family caregiver. The 24 hours of annual respite care we received last year, it may not sound like much, but for me, it was everything. I could run errands, take calls without interruption, or simply breathe. Quotes like this remind us why we're translating data why translating data into action matters, and how even small, well-designed support programs can make meaningful differences in caregiver lives. Next slide. This webinar, as mentioned, is part of NAC's ongoing partnership with U.S. Aging through the Innovations Family Caregiver Services and Supports Initiative. NAC serves as a partner to strengthen the aging network capability to deliver innovative person and family-centered caregiver supports, and to advance Goal 3 of the National Strategy and Support Family Caregivers, which focuses on strengthening services and support nationwide. With that, I'll turn it over to Claire D. Matuba from U.S. Aging to share more about this partnership. Over to
Thanks,
you.
okay. Thanks, Melina, and hi, everyone. I am Claire Dean Matuba, a senior program manager with U.S. Aging, and I work on the Innovations and Caregiver Services and Support Initiative. Um, Next slide, please. Thank you. And I want to acknowledge before moving on that this project and also today's webinar are made possible through funding from the Administration for Community Living as part of a 4-year initiative focused on strengthening caregiver services and supports. And that partnership is what enables us to share these insights with you today. Next slide, please. Here you'll see our mission and vision, and of course you can learn more about us on our website. But we are the national association that represents the network of area agencies on aging, and we also advocate for the Title VI Native American aging programs that help older adults, people with disabilities, and family caregivers live with optimal health, well-being, independence, and dignity in their homes and communities. Next slide, please. This project is part of the National Caregiver Support Collaborative, which aims to ensure greater recognition, support, inclusion of family caregivers served by the Older Americans Act Titles 3E and 6C, and greater alignment with other efforts to improve supports for family caregivers. The collaborative is a national effort led by ACL to implement and advance the 2022 National Strategy to Support Family Caregivers, which is a comprehensive framework with 5 goals, clear objectives, and actionable steps organizations can use to better serve family caregivers. A 6th project, also led by U.S. Aging, focuses specifically on caregiver navigation services. Within the NCSC, U.S. Aging's role includes 3 key components. As mentioned by Melina, we are leading Goal 3, which is to strengthen caregiver services and support. And through that project, we are working to expand the Aging Network's capacity to not only develop, but also deliver innovative person and family-centered services that truly meet the needs of caregivers. We are partnering with NAC on Goal 5 to advance caregiver research and evidence. And another team at US Aging is also leading a project to test, understand, and evaluate caregiver navigation services. Next slide, please. This is a listing of all the national partners that we work with on this project, including NAC. Their expertise and collaboration help us develop and share resources like today's webinar with the Aging Network. Next slide, please. We have developed several resources to help Aging Network organizations deliver more person and family-centered caregiver services. These include an action guide series, which offer practical tools to support implementation and enhancement of caregiver programs. These guides, a total of 8, align with the critical areas under Goal 3 of the national strategy, including respite care, kinship care, emergency preparedness, education, counseling, and peer support. We also have a Caregiver Services and Supports Innovations Hub, which is an online clearinghouse that highlights innovative, evidence-informed caregiving programs and practices that can be easily replicated by aging network organizations. We also have a Caregiver Champion Collaborative, which is a national peer engagement forum that brings caregiving professionals together to share best practices, strengthen connections, and learn about emerging trends. I noticed that Lauren added our link to the chat. You can please feel free to explore our website and learn more about the different resources that we have available. Next slide, please. Okay. Once again, thanks everyone for joining us. And as you continue with the webinar, I hope today's insights will help you strengthen and support and better support the family caregivers that you serve in your communities. Thank you. And with that, I'll turn it over to you, George.
Thanks so much, Claire. Yes, hello everyone. My name is George Kippers. I am a senior research manager at the National Alliance for Caregiving, and I am very excited to share some data from our Caregiving in the U.S. 2025 study. Much of the data that I'm going to be discussing is from our Caring Across States profile or report, which can be found at caregivingintheus.org, and I'll share the link when I'm finishing up here. Next slide, please. Yes, very, very excited to be talking about Caregiving in the U.S. 2025, our state profiles. We can go to the next slide. Caregiving in the U.S. 2025, Caring Across States, is based on a comprehensive state representative data collected, was collected for the first time in the Caregiving in the U.S. 2025 survey. We've been running this survey for quite a while now. Most recently, the last every 5 years, we've collected this data. So 2015, 2020, and then 2025. But this is the first time that we were able to calculate both prevalence estimates for every individual state, as well as the District of Columbia, as well as for a number of states, we were able to create analyses based on all of the survey questions that we ask in the Caregiving in the U.S. 2025 survey. Just some general information. Again, Caregiving in the U.S. Found that 63 million adults, which is roughly 1 in 4, provided care in 2025. This number includes caregivers of adults as well as children with disabilities or complex medical conditions. This state data ultimately builds on the July 2025 national report, which provides analyses, again, of all of the items that we measure for caregiving in the U.S. For example, whereas the national report focused on 59 million family caregivers of adults, this state-level resource includes data on an additional 4 million family caregivers, so those who care for children under the age of 18 with disabilities or complex medical conditions. Next slide, please. The report that focuses on the state-level data, this report highlights the similarities and differences in the roles of family caregivers across the U.S. And ultimately shows how place can affect and shape the lived experience of the 63 million family caregivers. Family caregiver prevalence, which is the share of all adults who are over 18 who are family caregivers, and again, caregivers of children with complex medical conditions or disabilities. This prevalence ranges from 20% in Washington, D.C. to 34% in Mississippi. And again, nationally, the prevalence is 24%. So the number of family caregivers, the overall figure for each of the states ranges from 107,000 in Wyoming to 7 million in California. So you can see this map. We actually have an interactive version of this map that you see here on the Caregiving in the U.S. website that allows you to hover over each of the individual states and see what the actual number is for each of the states. So definitely encourage you to check that out. And again, I'll share the link at the end of my presentation. Next slide, please. So just a little bit of background in terms of the methodology for this for data collection initiative. So data was collected from August to October of 2024, and the data includes surveys from 6,858 family caregivers who are ages 18 plus. This is the primary data source. So the individuals who completed these surveys were a probability-based Ipsos knowledge panel. And then those surveys were supplemented with non-probability opt-in panels in smaller states to try and increase the number of responses. Overall, our survey defines caregivers as adults who are providing ongoing care in the past year to adults or children with disabilities or complex medical conditions. Also, just a note, the state prevalence estimates were created using state representative samples or modeled estimates, which HLM refers to hierarchical linear modeling. So just a note on how we arrived at the prevalence estimates based on the data that we collected. Additionally, the counts of caregivers were calculated by applying the prevalence rates to state adult populations. 32 states have sufficient sample sizes for detailed analysis. The remaining states report only prevalence. And I'll share an example of the table that summarizes which states we were able to share detailed analyses and which we were only able to share overall prevalence estimates. Next slide. So just a couple of key findings overall. Again, in this Caring Across States report, you'll be able to see detailed what we call profiles of the data for each state, each of the 32 states that we were able to do detailed analyses on. I'll share an example at the end of this presentation, but these are just a couple of findings to give you a sense of what you can expect to see in looking at the summation of findings across the United States on a state-to-state level. So again, as I mentioned, in terms of prevalence, it ranges from 20% in DC to 34% in Mississippi. The number ranges from 107,000 in Wyoming to 7 million in California. And then we measured a number of other things too that we're able to calculate these additional analyses on. So for example, intensity of care. So nationally, 28% provide 40 or more hours of care per week. So thinking about this as almost an additional full-time job. Then the percentage of family caregivers providing 40 or more hours of care per week, that ranges from 14% in Iowa to 37% in Tennessee, just to give you a sense of some of the range in terms of proportion. Next slide, please. So I repeated this bullet here accidentally, but just a little bit of background in terms of how we talk about intensity of care in CGUS. We use what is called the level of care index. This was first developed in the 1997 Family Caregiving US study, and it conveys a simple measure of the intensity of the caregiving situation using objective information. So the level of care index is based on the number of hours of care given and the number of activities of daily living, as well as the number of instrumental activities of daily living. So hours, ADLs, and IEDLs. Just to give you a little bit more background, in terms of activities of daily living, these are routine tasks that are essential for maintaining personal independence. They include things like bathing, dressing, feeding oneself, toileting, getting out of beds and chairs. And then in IADLs, instrumental activities of daily living, are complex tasks necessary for independent living. These are things like financial management, meal preparation, housework, transportation, and shopping. So as you can see, the percentage of caregivers who help with any ADLs ranges from 54% in Indiana to 76% in Georgia. Very high proportions based on our results. And then in terms of the level of care index, the percentage of family caregivers engaged in what we define as high intensity care ranges from 32% to 55%. 32% in Wisconsin, 55% in Tennessee. Next slide, please. Just some additional key national findings in terms of the range of proportions, some of the additional analyses that we were able to conduct on those 32 states. So another thing that we ask has to do with interactions with healthcare providers. As you can imagine, family caregivers play a critical role in healthcare management and delivery across the country. Nationally, 64% of family caregivers communicate with care recipients providers proactively. Lower numbers of family caregivers report being asked by healthcare providers about care needed for their care recipient. Specifically, 27% nationally report being asked. And then that ranges from 15% in Indiana to 38% in New Jersey. Many caregivers also advocate for the care recipients with healthcare providers. That's another question that we ask. And this ranges from 46% in Utah to 71% in South Carolina. And then even higher margins report monitoring the severity of their care recipients' conditions so that providers can adjust the care accordingly. And this ranges from 60% in Wisconsin to 81%, and that's in Indiana and Maryland. Next slide, please. So as reported in the Caregiving in the US 2025 national report, family caregiving can result in substantial financial consequences. So we ask a number of questions about financial hardships of family caregiving. The questions that we ask include things like, has family caregiving forced you to stop saving or use up savings, take on more debt, pay bills late, or not being able to pay bills at all? Nationally, almost half of family caregivers, 48%, experience at least one negative financial impact because of caregiving. And across the state, this ranges from 34% in Minnesota to 59% in Georgia. Additionally, difficulty finding affordable services, such as delivered meals, transportation, in-home health services. This can also affect family caregivers' financial situations. So nationally, 28% of family caregivers report having difficulty finding affordable local services for their care recipient. And this ranges from 17% in Arizona to 39% in Maryland. And then across the states, the share of family caregivers, 17% in Arizona to 39% in Maryland. Next slide, please. In addition to negative financial impacts, a couple of other things that we measure in the Caregiving in the US survey that we found significant impacts for caregivers include work impacts as well as impacts to health and well-being. So caregiving often comes at a cost for working family caregivers, having to navigate dual responsibilities of being employed as well as caregiving. Nationally, 60% of caregivers were employed outside the home. And then this ranges from 42% in Arizona to 38% in Connecticut. In addition to workplace impacts, self-care and taking care of one's own health for caregivers has been noted as a challenge for caregivers. 1 in 5 caregivers report fair or poor health, and nearly a quarter, 24%, say they have difficulty caring for themselves. And that reporting difficulty taking care of their own health ranges from 12% in New York to 31% in Florida. Additionally, I discussed previously interactions with healthcare providers. Another question that we ask has to do with whether or not caregivers report being asked by healthcare providers about care that they themselves need. And this is unfortunately very low as well. It ranges from 7% in Kansas to 26% in Maryland. And then lastly, we also ask caregivers about having health insurance coverage. And then these proportions range from 77% in Texas to 95% in Illinois. Next slide, please. So I mentioned that there are some limitations to this data. The main one being that we didn't have sufficient data to calculate detailed analyses for all 50 states. We were only able to do them for 32 states, whereas we have prevalence estimates for all 50 states in DC. So this is an example of our table 1, which shows the overall prevalence for every state. And again, you can find this in the Care Across States report. Next slide, please. Oh, sorry. Go back one. My fault. I think I might be missing a slide. That's okay. I will just showcase that we have another table in the Caring Across States report, which is it shows essentially which states we were able to conduct detailed analyses for each of the areas that I discussed. So including prevalence, who caregivers are, what they're doing, the financial situation, well-being, working while caregiving, as well as demographic characteristics. And just a word of caution that we always include in terms of interpreting this data. So caution can be used in interpreting differences in state caregiving prevalence as reflecting preferences or state policies alone. Many elements can factor into caregiver prevalence in the state, including the composition, age composition of state residents, cultural, and sorry, my dog is barking, if anyone can hear that. Sorry, let me just repeat that. So a lot of factors go into caregiver prevalence for state, including age composition of state residents, cultural and regional preferences for care at home, as well as the availability of professional direct care workers, and this, as well as lastly, the state's long-term services and supports policies. So just a couple of limitations to consider with this data. Next slide, please. So overall, family caregiving has grown by 20 million people since 2015. The economic value of unpaid care is estimated at roughly $600 billion. Caregivers need strong policy, financial, and health supports, and our ability to showcase this data on a state-by-state level highlights opportunities for targeted solutions. And then I'll just quickly share my screen to give you an example of the state profiles that I mentioned. Oh, sorry, let me share the next slide before I do that, and I'll show you. So the next slide, this is the link to the state level reports. It's caregivingtheus.org. Obviously, there's a detailed URL there, but if you just go to caregivingtheus.org, you can scroll down and find more information on the state profiles that I mentioned. And just to give you an example, I can share my screen really quickly. I can figure out how to do that. There we go. Okay, so this is an example of the state level profiles that are included in the Caring Across States report. So you can see this for, again, the 32 states that I mentioned we were able to conduct detailed analyses on. So for each of those 32 states, if Wisconsin is an example, you'll find these profiles. So for Wisconsin, for example, it shows more than 1 million adults in Wisconsin provide care. And then you can see a number of different estimates that we have as well for each of the states. So, for example, with Wisconsin, on average, family caregivers are 52 and care for someone 69 who are 69 years old. Over half of family caregivers in Wisconsin work while caregiving, so that shows 55%. And you can see some of these demographic breakdowns. And then we also are able to showcase these detailed analyses for each of those 32 states in terms of what family caregivers are doing. So the activities of daily living, ideals that they're helping with, the intensity of care, and really just able to showcase specific data for these states that are kind of an overview of each individual state based on the survey questions that we were able to ask. So I definitely encourage everyone to check out these individual profiles if there's a specific state or a few states that you're interested in. Definitely consider taking a look at these individual profiles. You can see there's a lot of data that we're able to showcase for these state level profiles. And with that, I will stop sharing, and I will turn it over to Bryn.
Hi, good afternoon. Thank you, George. I appreciate it. And thank you, US Aging, and to the National Alliance for Caregiving, allowing me to present today. Um, as soon as we get started, there we go. I can make that work. My name is Bryn Seaman, and I'm the Caregiver Program Specialist with the Greater Wisconsin Agency on Aging Resources, or GWAR. So I have a very unusual name and also work for a very unusual company, which means people tend to remember me. So I did put my email address in there. If there's any follow-up from today, please feel free to always reach out. I also happen to be a member of the Wisconsin Family and Caregiver Support Alliance, and I think that we have now about 13 different organizations represented in that alliance. So we're a small but mighty force here in Wisconsin. And we are also a part, Wisconsin that is also a part of the Caregiver Nation state network. Which allows us insight into a lot of really innovative programming, technical assistance, and more. And also because some of the insight that I'm going to be sharing today is funded through our 2-year ACL grant. You'll see that acknowledgement on the bottom of the slide today. Next slide, please. So there is a lot of incredible data for each state, even if it's just the prevalence. This is all really good information. So thank you, George. I think the work that you've done is astounding. And the reason it's so helpful is that I think in many cases it's confirmed what we have all strongly suspected for quite some time. So as an example, in Wisconsin, we often used the statistic of 580,000 caregivers. And I often, when I was giving presentations, would follow that up by saying, well, and we know that there's more, or we suspect there's more, or that number is growing. Now, what we've been able to confirm with this statewide specific data is that there's actually 1.1 million caregivers in Wisconsin. We have roughly 6 million people in Wisconsin. That's including those under the age of 18. But if you look at just our adult population, 1.1 million is about 23% or almost a quarter of our adult population. So that's a pretty significant portion of our state population that's affected by caregiving in some respect. And the best way that I could work with this data and how we're going to be able to use this moving forward is to prioritize. Because it's full of so much information, you need to really find out what questions you have. Maybe even setting for the year a goal. Are you looking at volunteerism, staffing, access to resources, more public outreach and education toward family caregivers, caregiver self-identification? Whatever your goals are, I would begin by asking that question and looking at your state-specific data to help you determine what some of those insights are. It will guide you and it will help you prioritize versus trying to feel like you need to tend to all of the different issues that are listed. So in Wisconsin, these are the statistics that stood out to me. That we only have 8% of caregivers who are receiving training for the care that they're providing. That's really, really low. If you were hired for a job and I know more than 90% of us didn't receive training. Excuse me. If only 90% of us received training, we would probably not be on the job for a very long period of time. In addition to that, about 55% of family caregivers are also balancing their job as well as doing caregiving responsibilities. So this means they're likely holding down 2 different jobs. As George pointed out, in some cases, we have caregivers that are working and also doing 40 hours or more of caregiving. Then in Wisconsin, we also noticed that only 85, I'm sorry, of all of our family caregivers, 85% have never used respite. So that means you're potentially doing this work not receiving training, doing this work and not having any break for it either. The good news that we did find from the data is that 95% of family caregivers did have access to internet in their home. Next slide, please. Oh, I apologize. I am so sorry. Of course, right when you're doing a presentation is when you get a tickle in your throat. So, why state level caregiving data matters to area agencies on aging. AAAs, as we're often known, are uniquely positioned. They are the ones working with caregivers. They're the ones who are hearing the stories and the struggles. They're the ones who can collect the caregiving stories. And they're the ones who are able to connect those caregivers potentially not to just resources, but also if they have a niche of advocacy or wanting to tell their story at a local, state, or even federal advocacy event, AAAs are in those capacities to make those connections. And if you're anything like us, you probably don't have all the staff that you want. You don't have all the volunteers, and you don't have all the funding you need. So this state-specific data also helps us prioritize our limited resources, whether that's funding, whether that's staffing, or maybe that's even just the access. You don't have the capacity to maybe enroll people into the programs that you even have available. So this data matters because you kind of understand what the barriers already are. Thirdly, this absolutely strengthens credibility with partners. We found that in the case with Wisconsin with employers in recent weeks and recent months, but certainly with legislators and funders. You can start with either the data or the caregiver story. Both are great ways to lead the conversation, but they complement one another tremendously. Next slide, please. Why state level data matters to caregivers. So, what is most helpful when you're entering into a caregiving journey is learning from other people, recognizing that you aren't alone. And that's what this state-specific data offers. It highlights that at least in Wisconsin, we have over 1 million caregivers. And if you look at your specific state data, you're going to find it's likely a high prevalence. And I don't know about everybody, but if you're like me, it can be difficult. I'm so sorry. It can be difficult to ask for something when it's for yourself, either because you don't want people to think that you're selfish or you don't want to admit that you need help. When you see the numbers of 101 million or whatever it is for your state, you're empowered. That, emotionally connects with you because then you're asking for things and you're wanting things to improve, not just for yourself, but for all of the people who are in a similar situation. I think the state-specific data also highlights that it's okay to ask for help. And in many cases, if we want to preserve caregivers, if we want to delay nursing home placement, if we want individuals living in their home for as long as they can, we need for caregivers to know that it's okay to ask for help. And once again, the state data absolutely reinforces individual caregiver stories. So this is highly personal to them. Next slide, please. How we actually use the data. So this is newer data just from July, and we haven't yet had it for a full year. So how we can continue to use it is still developing. But I can share 3 areas where I know that it's been helpful and where I can see it being helpful. And again, same for each state listening in and for each AAA listening in. If you're able to start with that question of what you need to know as far as where to prioritize, where to focus, that data can help you in guiding your next steps. For us, it's absolutely policy and advocacy. We made the change for we asked for the change for some legislation here in Wisconsin beginning in January of 2025. And we did that with the previous numbers of 580,000 family caregivers in Wisconsin. So what we hope to do is reinforce our future asks by using these more accurate numbers and more up-to-date numbers. So we had this ask of lifting the financial eligibility requirements for our state caregiver program. So this is different than the Older Americans Act, NFCSP, but it was for our state program. And I'll tell you in a few subsequent slides how that ended. But I also see that this data is going to help us with our future ask, which is trying to get long-term funding for a 24/7 caregiver online education and training platform. So the idea is that whenever a caregiver has the opportunity to log in, they're able to get some training, education, and then the case for us, we are utilizing a provider, a partner by the name of Trualta, who's been amazing. And within that contract and our relationship, we also have access to something called the Community Bundle, which also offers virtual caregiver support groups, podcast style types of forums, webinars, and so much more. So we're also reducing some social isolation and loneliness as a part of this caregiver education and training. Partnerships. I mentioned employers earlier, and again, in the past few weeks and few months, we've noticed, probably because we've had our first exemplary employer award here in Wisconsin, and we've noticed more and more buy-in. It's very easy to reach out to partners that are within your aging and disability or your independent living center kind of network. You have your common folks that you go to. There's a shared opportunity to have a mutually beneficial relationship. Your missions sometimes align, you have similar goals, but being able to tap into the private sector, again, employers, I think that not only does it make your work lighter, many hands make light work, but they also then are getting to an audience that you previously haven't. So our partnerships are going to be big in how we share this data and how we drive our future engagement into our program innovation. So we have quite a few, and I saw that we even had somebody from Wisconsin, Kevin, who shared that we do have a direct certified direct care professional program in Wisconsin, which we're very proud of. And again, we have so many to promote, but also the two that I think we're going to drive home in the next year, couple of years probably, are flexible respite care options, and then also the caregiver training with Trualta that I mentioned. The Trualta caregiver training is just available 24/7 when our typical aging and disability resource centers or senior centers or aging units or AAAs just aren't available. And they're quick kind of micro bursts of training, which allow a caregiver in a short period of time to learn the necessary skills that they need. And then respite care, I'll get into this a little bit more, and there's a link within the slides coming up. But we absolutely need to have more than 85%, or really it would be 15% of caregivers receiving respite. 85% have reported they have not received any type of break. So with that, our goal has to be getting the word out about what's available as far as caregiver grant funds, respite care grants, and more. Next slide. Example one, here's a little bit more detail. I did have links throughout here so that you're able to, following today's presentation, dig into it a bit more. Again, I am all about making things easier, so this is intended to be something you can replicate. You don't have to start from square one. If any of this looks good to you, it's all available for you for the taking. This first link here is just sharing that our policy initiative from January of 2025, so just a year ago, was in fact accomplished, and we were able to remove those income eligibility limits for our state caregiver program. And that leads us right into our next policy ask and trying to make sure that we have sustained funding for that caregiver training and education. And I think that this state-specific data absolutely drives those points home to say that this is not an individual family situation. This is not just, a woe is me situation or this family or this person has really fallen on hard times. The numbers show that this is a clear systems issue. Next slide, please. This is an example of how we were able to use those state data um, percentages and statistics in the most recent Trualta Lunch and Learn. It was our first of more that we are planning, in which, again, we're engaging with partners beyond just our traditional network, looking to have private sector, university, employers, Department of Workforce Development partners in all of this type of knowledge and learning. And right here in the Trualta presentation, Sue, who's our partner, was able to take that state-specific data and show and highlight how this really fills a void in Wisconsin. And if you partner with Trualta, she'd be able to do the same thing with your state data and incorporate it into her Lunch and Learn or other presentation series. So that's one very practical way that this state-specific data can be used. Next slide, please. Example 2, partnerships. Again, unless you are fully staffed, fully funded, and have all the volunteer and bandwidth and assistance and capacity you need, I have to imagine that partnerships are going to be beneficial in any of the goals that you set for this year and beyond. We started and we have very active members within our alliance who come from different university systems, UW Extension, UW-Madison, UW-Milwaukee, and more. So we I'm really proud to say that we even have a family caregiver who's full-time a part of our alliance and very active in many of our subcommittees. So knowing that caregivers are sometimes the most busy people we know, if you're able to recruit them in your cause, they can be some of your greatest allies. We were also able, with the ACL funding that we received through that 2-year grant, able to offer a public awareness campaign. I can't show you all of our videos. There's just four of the 5 that we plan to have completed. But if you're interested, again, here's a link. You're welcome to go to it and check it out. We actually don't have any data that's really reported in these short videos about caregiver identification, supports that are available on our website, and that was intentional. We wanted our finite funding to be used well beyond the grant period, so we didn't want to put data in there that might change over time. It's really just about messaging and then bringing people to the resources and specifically our website so they can apply for grants, be aware of virtual support groups, and be aware of resources in Wisconsin. I've already mentioned this, but great new partnerships have come through our exemplary employer award. And that is also linked here to our press kit. So you can see who we all invited and who the award recipients were. I'm really proud to say that we were able to highlight work from both, well, really all 3, from a small, medium, and large employer. And our co-leads of that sub-work group did a fantastic job as far as bridging new partnerships and really helping to move forward the work of making caregiver-friendly workplaces. Next slide, please. Number 3, this is, again, a practical example of program innovation. We have several in Wisconsin, but these were the 2 I think really honed in on some of the data that we saw through the state-specific caregiver data sheets. The Healthy Meals, Healthy Minds Respite Program is offered through our lifespan respite grant provider in Wisconsin called the Respite Care Association of Wisconsin. This is an application for any caregiver to apply for $250 every 2 months to help offset the cost of nutritious home-delivered meals or health and wellness programming. So as you can imagine, we've heard how financial impact absolutely is a barrier for family caregivers. So too is respite. This meets both of those needs. Next slide, please. Just to make sure we can get through the next two slides without me coughing again, I will summarize and say that you don't need to do it all. I think that this is incredibly meaningful for AAAs to help them prioritize. Find partners where you have a shared purpose and that it's mutually beneficial. They're getting something out of the work that they're doing with you, and vice versa. I'd also add that this data very much complements and amplifies caregiver stories that you're uniquely positioned to collect and to share. Next slide, please. Small steps matter. You don't have to bite off more than you can chew. Absolutely look for those quick wins. That gives you emotional motivation and ability to move forward. Again, the data is not the whole story, but it is a great complement to the caregiver voice. And you have that ability to collect the information and move it forward, whether it's policy, whether it's outreach and awareness campaigns, or whether it's soliciting new partnerships to help make change happen. Next slide, please. This is my last slide. You can see that there's a QR code if you want to download the presentation. You can do that right on your phone. And then it also has a link to the information that I reviewed today as part of my presentation. Thank you, and I apologize again. I am so sorry, but I'm here to answer questions, and I will turn it over to Melina.
Thank you. Now, you did a wonderful job. All of you did a great job. And I think this presentation did an amazing job correlating how data is, with caregiver experience can make some really important work at a local level. We have a few questions, but I'm going to ask one that was asked during registration, and it's for you, George. What are 2 or 3 data points from the state profiles that are most relevant to the aging network?
Thanks, Paulina. That is a great question. And I think that the aging network is obviously a significant population that we're interested in providing data for this survey. I think that some of the data points that I shared just regarding complexity of care. For example, we find that especially for the aging population, and especially as it relates to folks who are dealing with complex medical conditions, particularly Alzheimer's and related dementias. We find that for these populations, there are significantly higher levels of reported level of intensity for caregiving. So again, thinking about the national estimates, I think it's somewhere around 20 to 30% of folks are reporting it a high level of intensity of care. If you look at these more specific populations, those figures can be much higher. Additionally, we also find that the demographic breakdowns for folks caring for individuals due to the aging population, so caring for older adults, there are a lot of significant differences if you look at demographics, whether it's rurality, so folks who are living in urban versus rural settings, as well as race, gender, LGBTQ status. So there are a lot of really great data points to dig through. And looking at this on a state-by-state level is even more interesting. So definitely encourage folks to check out the full Caring Across States report for more information and more detailed findings related to the aging network.
Thank you. And then for you, Claudine, is there a hub or organization that exists that's collecting like best practices across all caregiving organizations right now?
Yeah, thanks for the question. At US Aging, we do have a caregiver services and support innovations hub, as I mentioned during my presentation, which highlights innovative and evidence-informed caregiver programs from across the country. Organizations can submit their programs to be featured on the hub, and they can also explore to see what others are doing across the country. I wouldn't say there is one single hub that captures all best practices, but we do. For our hub, what we did is we linked to different resources that can also be helpful. For example, there are several other databases like the Family Caregiver Alliance and the Benjamin Rose Best Programs in Caregiving, which focus specifically on evidence-based programs. So what we did is link to those programs. That way, if someone accesses our website, then it'll be an easy way for them to be able to navigate to those different resources as well.
Great. Thank you, Claridine. And I'll ask you a question, Bryn. This is in the Q&A. It says, how do we balance the state and federal funding for respite care with covering more caregivers? We only receive so much, and at the end of the fiscal year, there isn't much left.
That's excellent as far as perspective and trying to figure out what other states are doing. And I can't say that I have the perfect answer. What I can offer is that if you don't already have a strong partnership with your lifespan respite grant partner in your state, and your state does receive those lifespan respite grants, build that partnership with them. We were very lucky here in Wisconsin to do that because when we have counties that run out of caregiver funds and have a wait list, that's kind of our systematic approach. We are then referring them to our RCAW, it's called Respite Care Association of Wisconsin. And it's not exactly the same. The grants and the programs operate differently, but it's allowing us to offer something to caregivers, and that's huge. Also look for those low cost or free caregiving services. I see already in the chat, there's a whole bunch, from AARP, the free training that's available and so much more. Harvesting a list and a resource list of what you can offer free of charge is a great way to at least give something to caregivers if you end up at the end of the year with nothing left.
That's amazing. Thank you for sharing that, Bryn. And with that, I want to say thank you to everyone for attending. We really hope you're leaving with new ideas on how caregiver data can inform your work, whether that's making program design, service delivery, policy planning, or community partnerships. When this ends, there is a survey that pops up. We really value your feedback. It helps us shape future programming. It will also be emailed after the webinar with all the materials. You'll receive a copy of the presentation, the recorded webinar, and all the resources that were shared. On behalf of the National Alliance for Caregiving and U.S. Aging, thank you all for joining us today and for the work you do every day to support family caregivers. I hope you all have a wonderful afternoon. Take care. Thank you.